Welcome back. This morning, we are continuing our coverage of Cyclosporiasis. This is the first time I couldn't even say it. And most importantly, how to protect your family's health. Nearly 400 cases of it are confirmed in Ohio. At least 46 people have been hospitalized. Today, we're just really going to look at protecting yourself, protecting your family. We have food safety state specialist and human nutrition professor Sonia Illich from the Ohio State University's Department of Human Services. And Dr. Illich, this is something of what's considered a seasonal emergency. We've seen this before. It's difficult, though, when you're thinking about what made you sick to think about what it was, because maybe you ate something a week ago and your symptoms are showing up. Yeah. So first, can you talk about your work at OSU and how it relates to this?
Yeah, so I study food safety, obviously. That's why I'm here. So I usually work with human pathogens like Listeria monocytogenes, Salmonella. Those are bacterial pathogens that can make us sick, and we study that in the lab. I'm also food safety state specialist, which means that I am mandated with doing the research that can be directly translated into practices that people can use to protect themselves at homes, but also for the growers, food services, etc.
All right, so this is peak time for you. So for this cyclosporiasis, right, talk about who's most at risk for this. I mean, it would seem if you're pregnant, this is something you really want to be careful with.
Yeah, pregnancy is definitely a time when you have to be careful with many things. Also, you have to take care of your nutrition. Many groups in our community are actually at higher risk of infections, including foodborne infections, including this cyclosporiasis. So, for instance, starting with infants, younger children, older people, we have a large aging population. Your immune system kind of ages faster than any other organ in your body. So as we age, we become more and more susceptible to foodborne diseases. Also, we become more susceptible to other underlying conditions that may contribute to our susceptibility to foodborne infections. We may take treatments, temporary treatments on medications that are temporarily making us susceptible that we're not even aware of. For instance, people in treatments for cancer, people with certain cancers, while they're receiving chemotherapy, are at heightened risk. People taking proton pump inhibitors, which are omeprazole or any prilosec, that can be taken even over the counter, can be more susceptible to foodborne diseases because these medications kind of neutralize your stomach acid, and then everything you eat goes down.
Okay, so look, real quickly, because I want to get time for this. People have been saying, experts have been saying, maybe look to frozen or canned as alternatives to fresh items.
Okay, so I want to say that we should not tell people not to eat fruits and vegetables because those are really important for us nutritionally. So everything that you can cook, cook. Right? That cooking is the one method that we know that we can guarantee that is going to kill Cyclospora. And then everything that you peel, and then after that, make sure that if your risk is low enough that you can buy lettuce that is a whole head. Do not buy lettuce in bag, etc. And then remove those outer leaves. Make sure you wash. When you wash, you scrub with your hands with running water. And if you're using cucumber or melon, something, use a brush. And then if your risk is high enough, avoid leafy greens, especially fresh herbs that sometimes we're not even aware that we're putting them in sauces, salsas, and stuff.
This was really great.
That's all.
Thank you so much, Dr. Illich.
Thank
you make
you
it
for
seem
having
so easy. All right,